If your child has a small head, does it mean he has Down syndrome? Let's be very clear. Yes, it is one of the signs, but it is not entirely the only sign. You can't entirely say that a child has Down syndrome just based on one sign. So you need to take your child for professionals for assessment and be clear and sure what is the problem your child might have. Let me first talk about the signs that even as a parent you can be able to see even when your child, even on the first day after giving birth. First, there is one line in the palms. Again, you find your child has slant eyes. Again, you find your child has a small neck, or he has a flat facial features, even small ears. Those are signs that may indicate that your child has Down syndrome. But also when the child reaches around 2 years and you find he's slow at memorizing things, he's slow at speaking, he's slow at everything, those developmental delays, those are also signs. But you can't be sure until you take your child for assessment. What should you do? First of all, don't panic. We've seen with that intervention, Kunga therapy, speech therapy, occupational therapy, children can be trained with that intervention, having Kunga therapy, speech therapy, occupational therapy, taking him to play with other children. You are going to solve the problems of social interaction. The more he plays with other children, the more he's going to develop his speech, the more his memory is going to be sharp, the more his eye contact is going to be sharp, the more his attention is going to be sharp. And you are doing all those, again, also taking him for treatment. You can be able to change a lot of things. But like we always say, when you do this before 3 years, you can be able to change. I've seen many children with Down syndrome who are studying with other kids and are performing like others. But when you look at the parents and they tell you their stories, you find they started intervention at an early age. The problem is not that your child has Down syndrome. The problem is, what are you going to do about it? If you take him for Kunga therapy, for speech therapy, for occupational therapy, you can, especially occupation and the Kunga, you can be able to deal with that raw muscle tone. So the more you train his brain and at an early age, you can be able to achieve wonders. So what matters, or the problem, is not that the child has Down syndrome. The problem is, what are you doing about it?